traditional medical model is based on symptoms and a diagnosis of what those symptoms are, but it doesn't often address why you have the symptoms. So if you went with back pain, neck pain, although anti-inflammatory drugs may be a useful thing in the short term to reduce inflammation, in the long term you won't understand why that they have that inflammation, what's gone wrong within the body as a whole. Otherwise you'll be hooked on painkillers there for life, which doesn't address the problem and will allow further damage to occur.
Back pain is the commonest thing we're known for. Back pain, neck pain, headaches would be the average person's thought, and they affect a huge portion of society. And the amount of people who have time off work through these type of complaints is enormous, and we can help a vast number of those type of issues.
And because chiropractic, especially in this clinic, is a whole body, we look at everything all together. So therefore we also look at nutrition, we also look at giving rehabilitative exercises as well, just to make sure that when we treat you and you're feeling really good, that when you leave you can maintain that yourself. And that's through diet as well as through doing different sorts of exercises as well.
Now chiropractic is a very safe and gentle effective treatment to the nervous system, and we use the joints to achieve those changes. So other people may come in with pain in a certain area. The reality is what we're doing is affecting the way the nerves work to allow the body to then correct itself in effect and heal itself.
Probably the most stressful event that happens to us possibly in our lives, certainly in our early life, is our birth. The forces that are driven through the birth canal are massive. Kids and babies need chiropractic equally as much, if not more, than adults, because we can prevent the issues they're going to get in later life if we see them when they're young.
When patients come in, they'll often have symptoms for many, many years, and will have put up with this for a long time. So we're not interested in the symptoms itself per se, but why they have those symptoms. So what's the cause of their pain?
It's like an onion skin is what I describe it as. So they come in with one layer, you take that layer off and you find something else, and you just keep going through the onion until eventually the patient feels a lot better.
We see a lot of patients referred by GPs, by hospital consultants, by physiotherapists, by a whole band of stuff, and that's what we're seeing more and more, and that's great. And so we're part of a team working on the health of the nation, if you like. That's the way I like to think about chiropractic. We've got our place. Our place is now beginning to be recognised by more people within the whole of the caring professions.